there's two overarching principles or ideas or something that are needed. One is a vision, and that can come through education. It can come through storytelling. It can come through mentorship. It can come through personal experience, but a vision. So the vision, again, I think needs to be health and well-being for all.
Hello, everyone, and welcome to another episode of Wellness at the Speed of Light. I'm very excited today to talk to Dr. Chad Swanson, an emergency room physician that I've actually been following. And we were just chatting here before we got going on the talk. And fascinating, the reason that I was, kind of so intrigued and wanted to have him on the program is because he and I are both interested in a lot of the same content. We're both concerned with what's going on in healthcare. And I've been following him on social media for a while. And I just noticed, I was like, wow, everything he's kind of posting and reposting is all things that I'm interested in. And so it is excellent to have somebody that is a physician who also is identifying some of the holes in the healthcare system, some of the things that we really need to do to make our population happier and healthier. In addition to being a physician, he also has a great background in public health and has studied that and is really passionate about it. He's currently writing a book, which we were just talking about, and just excited to have you on the show today to talk about. And I love to talk about with fellow physicians who can see that something is wrong and that changes need to come. Love to have these kind of fireside chats. And I think that the audience really enjoys it because people deep down inside know something is wrong. And sometimes they don't know quite what's wrong. And they're relying on insiders like yourself to say, hey, I have this other perspective. I see you guys every night in my emergency room. And here's what's really going on. Here's to some of the things you need to know. So thanks for being on the program today.
It's a pleasure, and thank you for inviting me. It's been really enlightening and interesting to follow your posts and your videos and podcasts as well. I love your passion, love your energy related to wellness. We both see the flaws of our health system. So we see patients. I see them in the ER when they come in with diabetic complications or heart attacks or strokes or mental health emergencies. You see them in the operating room, or you're not able to operate on them because of their health status. So yeah, really, I'm most interested in a historical transformation, a societal shift in the way that we approach health and well-being. So I'm not talking about only tweaking one aspect of payment or only tweaking the way that a certain medical encounter is approached. I'm thinking about a historical change in health and healthcare. So let me just share maybe in a couple minutes kind of the way I see that things played out over the last 130 years or so. You mentioned I'm a full-time emergency doctor. I also have a master's in public health from Johns Hopkins. And over the last 8 years or so, I've been researching and writing about an interesting time in the history of medicine. So this is the 1890s. So this is a time when there weren't spine surgeons. There weren't emergency physicians. There weren't even hospitals for the most part. So this was a time when everything was up for grabs. So germ theory was relatively new and just gaining traction. Nursing as a profession was new. So if you can imagine as a physician working in a small town, so the characters I've been researching lived and worked in Raleigh, North Carolina. So a town with a hospital or two, but these are just houses. I mean, these are just houses with 2 or 3 rooms. These aren't big, huge buildings like we know of today. And you have a choice. So your choice is, well, let's take a step back. Your vision is to improve the health and well-being of your community. So my main character was a doctor named Lawson Scruggs. He was born into the world of slavery. He was in the first graduating class of the first medical school for African Americans in the state of North Carolina. And he gave this bold, visionary graduation speech from medical school where he said there could be millions of improved health for Black and African American people. And so he set out to practice medicine. Now, for us, that's fairly obvious what we would do. We'd start working in a hospital or a clinic. But for him at the time, it wasn't so obvious. So he had a choice as to whether to teach or to work in the community or to write books or to set up his own clinic, and whether to focus on preventative medicine or treatment. He had already shown proficiency in surgery. So he ended up spending about 10 years working in a variety of settings and fields. He wrote a book empowering women because the status of women at the time was an important determinant of health. He taught sanitation, which is the same as kind of public health as we think of it today. And so what I learned is this is a man who had he wasn't constrained by the assumptions and the institutions that we have today. So you and I inherited a healthcare system with a variety of assumptions and institutions that don't have to be the way they are today.
Right.
So what I learned from him is that if we keep a relentless focus on what we really want, and I would claim that what we really want for our families, for our communities, and for our nation is optimal health and well-being for all at the lowest possible cost. So I think we all have different political persuasions, we all have different backgrounds and perspectives, but I think if we sit down with most people, what they would agree that we all want health and well-being. And I'm happy to talk about the implications for that. But Dr. Scruggs, with that focus, he was involved in a variety of different activities, and then ended up working with a number of nurses. Marie Burgess was the name of this African-American nurse leader, and they went out into the communities. They developed relationships with the people. They focused on health education and prevention, and the death rate among African Americans plummeted, and it was an incredible success. And then there's more to the story. But thanks for having me on. That's kind of a brief overview of the story that I've been interested in and implications for today.
Thank you. That's great. I'm excited about it and to learn in there. And you're absolutely right. One of the things that I have, it becomes clearer and clearer to me is what you just said about the preconceived notions, and it's a big problem. And so when I was sticking in my own lane, right, I trained at Columbia, I did my spine surgery fellowship at University of Louisville, and then I went out into prep, but I was staying in my lane as I was taught. And I was taught a certain things, but as soon as I started going out of my lane, going into the preventative health and wellness, integrative health, all this stuff, I just started realizing how difficult it was with people's preconceived notions, where things were so clear to me, even by research, because we have like I'm really into light therapies and stuff. There's thousands of articles on this stuff. The science is hardcore, rock solid science. Even with the hardcore science, because the preconceived notions, people automatically assume that these things, because we were not taught in our schools, or because it's not the way it is, or even for the general public, they're not aware. I've never heard of that. So therefore it doesn't work, because I haven't seen 19 commercials during the Super Bowl pushing this drug on me. Like, right, if we pushed light therapy or preventative medicine or 19 times during a football game, guess what? After a while, people would be a lot healthier. But we're pushing, right? We're doing candy commercials, Doritos. We're doing every skin condition and these medicines that have 10,000, side effects, anti-cancer drugs, all these things, we're pushing them on the public. And we have all these preconceived notions. And I think that is brilliant. And one of the guys that I really like following, and I don't know if you follow him or not, is Robert Lustig. and he writes, he wrote the book, The Hacking of the American Mind. And it's very interesting because you're right. It was kind of like, like the philosophical thing, tabula rasa. It was a blank slate for that guy. He's like, well, I got all these choices. I can do all these things for these people. We're the opposite of blank slate. By the time I came out of my medical training, man, they had a foot soldier. This is their guy, right? Right. And with all big pharma and big food and all these people that have all this influence on the way we're trained. And I had to really take I had to take the red pill and get myself out of the matrix and realize that I was just as much of a part of the problem of everyone else, because I'm buying into the system as is today. And honestly, if we went back in time right now, 10 years ago, and you asked me and I heard you talking about everything that's wrong with the system, I was like, what's wrong with this guy? Everything's great. We're doing stuff. I'm a spine surgeon. I'm busy. I'm happy. And I couldn't be farther from that place, because I see at some point you start seeing it. You see people sicker and sicker and all this other stuff. So I love what you say. And I want you to talk about that more. These preconceived notions. I mean, when you see patients in the ER and you start talking to them, I'm sure you hear, I love talking to ER docs, because I'm sure you could tell us, I mean, and people love listening to stories about, and I'm not going to get graphic because the stuff that happens in the ER, we all know the craziest of the stuff. But as far as and we'll get to our profession, because there's just a lot to unpack, but as far as people, these diabetics that come in, hypertensive emergencies, stroke, mental health, would you agree with me that their understanding of how their lifestyles and how everything they've done and all their medications that they take, it's really lifestyle. Do they have any understanding of how that correlates with them being then on on the gurney with Swanson saying, you got to, oh my God, this is an emergency. We got to do this, or we got to do that, or we got to resuscitate. Is that part of how big is the public's brainwashing by all of these forces, in making us a healthier society?
That's a great question. And, there are a number of preconceived notions that I think need to be challenged. I would argue that you inherited, I inherited, our whole society inherited a system that's driven by three main forces. So the first would be episodic, sensationalist treatment. Mm-hmm. So by that, I mean ER care, essentially. So from the way that we reimburse, so fee for service reimbursement, I get paid not to keep people out of the ER, which is what we all want. I get paid not to make people better. I get not paid, not even for the most part, to provide value care. I get paid to see more patients. Mm-hmm. And not only that, to do more procedures and to document in a way that provides evidence that I've cared for a patient that's really complicated. So essentially, we've set up a system that's financially invested in episodes of treatment. And I would argue that your medical practice is similar. You get reimbursed financially to do more and more surgeries, and that goes across the entire system. So regardless of, for the most part, and there are some small changes that are happening. So the first force again is episodes of treatment. And the problem with that is that health is a journey. It's an ongoing journey that begins long before that episode of ending up in the ER or on your operating table. And it's a journey that we embark on with a number of other people, from family members to community members to even our society as a whole. You mentioned a number of the forces, corporate forces and political forces that influence our health. So the second major driver that I think developed out of the 1890s and that we've inherited today is profit maximizing. Mm-hmm. So from the medical establishment to the pharmaceutical companies to hospitals to insurance, we are maximizing. We are putting profits before health. That's, if we look at the system as a whole, and we've all seen the graphs, I'm sure, but we spend about twice as much as other high-income countries on health and healthcare. And despite that, our life expectancy is several years less, and we can just do much better. So the third major driver that I think we inherited and that developed back in the 1890s and became solidified over the years is, I would call it, elitism. So just this idea, and back in the 1890s, it was, and still is to a large extent, it was about race, it was about gender, but there's also institutional elitism. So kind of the idea that if somebody goes to an elite institution, so in your case, Columbia, in my case, Johns Hopkins, then that knowledge, that expert knowledge is more valuable than, say, a mother has with the care of her child. And that's simply not true. If our goal is an episode of treatment, then that might be true. But if our goal is the health of that child, then the expertise of the mother and the community members is just as valuable. So episodic treatment, profits, and elitism dominate our system today, I would argue.
Mm-hmm.
And what we need is to change every aspect of education, research, policy, finances, to value health,
Yes,
well-being for all at the lowest possible cost. And we can do that by changing our vision, by telling stories, by speaking up like you're doing. And we can do that by changing incentives. So financial and other incentives. People are incentivized by a variety of things. And you asked about the public. So I think the public and my patients are influenced by those forces as well.
Absolutely.
We are all, I mean, if my child or grandchild now, if my child or grandchild gets in a car wreck, I want nothing more than the absolute best treatment for that child. And we all do. We all want, and we're driven out of love and fear and lots of forces. We're driven to want the best episode of care. And yet that a desire that we all have, that's deeply rooted in what it means to be a human being, if it's taken to the extreme, then what we're doing and what we do today isn't in line with what it means to be healthy. And then the public also inherited the flaws, and we're seeing a lot about insurance companies now and pharmaceutical companies, but just this profit. I have no problem with profits necessarily, but as long as that's not the major driver, as long as it's not undermining health and well-being for all.
Yeah, I know how you get. I just kind of, people ask me questions, and next thing you know, I do it all. No, that was actually, you answered the question great, because those are three things that I couldn't agree with you more. I love the way that you put it. I love the sensationalism word, because a lot of, listen, we're a sick care. We treat sick care. 90% of our expenditures are in sick care. These episodes where people are sick, and you know, that's a lot of acute stuff, but there's all this chronic illness, which is just way overburdening us. 80 to 90% of that is absolutely preventable with lifestyle changes and other things that we talk about. It absolutely is. And I love that word, sensationalism. And a lot of times, you know, I use words like exaggeration, over treatment, all these other things. Like, people come in, it's their first episode of being like pretty hypertensive, and the next thing you know, they're on 3 hypertension medicines. They're on all this stuff. It's not even we haven't even, like, there's not even a root cause. There's nothing. And that's what we do in our system. We just start dishing out scripts and I'm not saying anything. Obviously, if you have a hypertensive emergency, as you know, as an ER physician, you got to deal with it. But if you have one bad reading in a doctor's office, or even 2, and something's going on, a lot of times people come in and then you start investigating. Even as a spine surgeon, we're trying to clear people. I'm like, well, why are you on this? Why are you on that? And then we can't even find why. I don't even know what is all of this care. You're getting all of this care, and that care is causing even more damage. And it's a vicious, you know, spiral, you know, downwards. And I can't even explain to you how many times I see patients and I see kind of how they're treated for an episode of whatever, a flare up of chronic pain, and they end up having the kitchen sink. I mean,
Yeah.
why? how did we ever, get here? I want to really break down like a lot of the other stuff you said, and you're right, profit over health. Now, I think a question that needs to be asked, and I've asked this and I repeat myself quite a bit. You said it well. We spend a crazy amount per capita. It's a $4.4 trillion, that's an estimate, going to 7 trillion by 2030. And yet, if you look at every metric, except for smoking, which we've decreased, that's it.
Yeah.
But everything else, obesity, diabetes, autoimmune disease, mental health disorders, dementia, type 3 diabetes, some would call it, blah, blah, blah. All of those things are going the wrong way. We spend more than everybody. Our bills are crazy. I don't understand how it's not recognized that we are failing. So it's like I'm saying stuff. It's not even shocking. It's obvious. Any business, right? If you're a business, if I said, you know what, let's do a business together, and we said, you know what, the budget's $1 million, and we have, this is what we're gonna. Here's the deliverables, but instead you spend 5 million with half of the deliverables, and you look at me, smiling and say, what a great job. This is amazing. Wow, our system is great. This is the best company ever. That's what we're doing with American healthcare. And I just don't get why it's not more, front and center. And then I'll say one more thing, and I want to get into the recent events because you brought it up a little bit, and we have to talk about it. And I've talked about it a lot, and people really want to talk about it. But the elitism thing, I talk about it a lot. Not only is it an institutional thing, because there's a lot of ancient wisdom out there, and I have learned so much about it: energy healing, the power of yoga and meditation, spiritualism, the power of tapping into all these other things, the power of light and oxygen, all this stuff. Those are wisdom, and I love it. Mothers, the intuition of a mother, the intuition of parents, the intuition of communities, of societies. It's brilliant. It's amazing stuff. But we throw that in the garbage. That's not scientific enough. That's not, the NIH won't fund that, so it doesn't mean anything. So it's really frustrating. And then the other part of the elitism is that when we feel like we are part of an elite, like an elite, like we're the Illuminati, you and I, right? Two doctors, we're part of this club. We're the only people. We're the holders of the wisdom. You got to come to us. Then we tend to treat in a very paternalistic way. And what I try to teach, like one of my spiels is, we want people to be CEOs of their own healthcare, which means it's a partnership. They're hiring us to help them manage their care. They're not coming to us to be preached to and lectured to for us to tell them what to do. Obviously, if they come in and their spine's fractured, I have to just say, we're going to put rods in you're going to be paralyzed. Here's what it is. There's not a lot of stuff to talk about there other than recovery and things like that. But when it comes to, I don't feel well, or I have this condition or that condition, we are educators. We want to teach and have this thing. And the elitism really hurts us. But it also, when you're elite and you know everything, because we all know providers and everything, we know, lawyers and accountants, there are those people that know it all. And then you don't learn, you don't keep an open mind, and you don't learn. So I thought your thing, I know you kind of were like, I'm not sure if I answered the question, was actually a brilliant, because it really encapsulates a lot of what's going on. Let's dissect into, really what is happening now. Now, I've been frustrated jumping up and down about this stuff. I know you are. And I talk about the insurance debacle a lot. And one of my issues with insurance, which is really driving me crazy now that I'm on the wellness field, it's very interesting. So little money is put into preventative care, biohacking, functional medicine, integrative, all these things, all ancient wisdom things that we could be putting money into. A lot of that stuff is actually not even covered. But yet on the flip side of it, we're then allowing people to become very ill. And then when they get ill and they need treatments, then it's delay, deny, and all the other things that, that we're hearing about, lately. And now it's all front and center. And so, every once in a while, you'll see a blurb on the news. Somebody will complain about something about insurance. But in the last 2 weeks, that's all people want to talk about, right? Is the United Healthcare CEO. And obviously it's a tragedy. There's no room for that. That's awful. And anybody that's, trying to make like that's a good thing that's ridiculous. But yet it has allowed us to have more people listening when
Yeah.
we talk about how broken the insurance system, because I can tell you, it's beyond broken. So, what are some of your thoughts around? Because I know that this is where you're an expert. What are some of your thoughts about the problem now in the ER? There's not a lot of things that are going to be denied because you're right. You're dishing out emergency care, and so it's an emergency. But in general, what are your thoughts about, kind of the tragic events that happen, how they've put things to light, and what's wrong with insurance and what are some of your ideas about how we can make the insurance system, better? I mean, we can talk about universal health care. We can talk about, like prior authorization process, whatever. Tell me just, I gave you a bit, that's a whole dissertation worth of questions.
Yes, I jotted down some notes here. I'm just going
Good.
to comment on kind of what you had to say. The first thing is you've said this, but I think we need to repeat it over and over. We're all invested in the system to some degree.
Yeah.
So some of us are much more invested than others, but that's the nature of complex systems like health. We are invested. I'm invested. You're invested, and so it gets messy and it gets complicated. So you ask, why hasn't it changed? I look to successful social movements of the past, whether it be the abolition of slavery or women's suffrage or the LGBTQ movement recently. We as a society are capable of change, despite the fact that we're invested, despite the fact, and really it takes a critical mass of people reaching a tipping point that's often unpredictable. And so the recent events with United Healthcare might represent an opportunity, despite how tragic it was. And I do not condone murder at all, but often events that are unpredictable can catalyze transformation in a system that seems stuck. I also want to just emphasize the fact, we have been and will continue to talk about a lot of need for improvement and the negative aspects of the health system. I just want to say there's a lot of positive going on.
Yes,
I mean,
of
I've
course.
worked with some of the most brilliant and caring and hardworking administrators and nurses and physicians and public health professionals and educators and researchers. I could go on and on. So on the one hand, wonderful people. On the other hand, we live and work in a flawed society, in a system that we inherited, and we're flawed individuals. I love your idea of people being CEOs of their own health. I mean, this idea that we, especially with the internet and the amount of knowledge that's out there, we can and should take ownership of our own health and gather a team around us like a CEO does that can support us. If the best thing, I think you've been a CEO, but the best thing, and I've owned a small business. So the best thing that a successful leader can do is gather around her other people that have the knowledge and experience that we lack. And so we need to do the same thing with our own health. I would add to CEO of our own health, I think we also need a critical mass, millions of, I'll call them system stewards, so health system stewards. The Ripple Foundation, I think, has used that term quite a bit as well. So people that, you talked about as a spine surgeon, you were in your lane and you became very proficient, and we need people that look outside of our lane a little bit, that consider the drivers of the system, consider the leverage points where we could intervene to disrupt the system, to transform the system. And I, years ago, kind of stumbled across a group of, it's a philosophy, it's a group of methods, it's an approach to life called complex systems, and really became interested in this idea. And I taught about it at university and published academic papers on how viewing health as a complex adaptive system can be transformational. So I would add, we definitely need CEOs of our own health. We also need systems stewards. So the idea of insurance, 6 months ago or so, read a book. I think one of the authors was Finkelstein. It's We've Got You Covered. It's written by an MIT economist. And the authors make a compelling argument, I think, for basic, universal, free health insurance. So regardless of our political persuasions, I think if we look at what's going on, who's covered, who isn't covered, Medicare and Medicaid, and it doesn't make sense. And so I think there needs to be a groundswell and logical and rational approach to the discussion. And I'm in favor of, again, basic, universal, free health insurance. And I recommend that book. I have absolutely no conflicts of interest whatsoever in that. As far as, you're absolutely right, I don't face the challenges that many, including surgeons, face in the ER. For the most part, ER visits are covered, and so I take care of patients, and that's not a big challenge for me. But I know it is for many, and I know it's incredibly frustrating. And just on a personal level, when I'm dealing with my own healthcare, my family's healthcare, it is very frustrating. So love those thoughts. Those are some of my quick responses.
I actually did an entire hour radio show and just gave people all these tips and tricks about navigating their insurance, how to pick their insurance plan, how to do this and that, because it is a complete, and you're right, it makes zero sense. You know how bad it is? It's so bad now that in our world, I have to get a cheat sheet before I go in to see my patients. So my staff will put together a cheat sheet, and it'll tell me everything that the insurance company will cover for that patient. And it'll also tell me all the hoops they have to go through in order to get whatever, an MRI, to get an injection, to get therapy, to get surgery. So I have to become like an expert in every single different insurance plan before I go in the room, because you know what else is you know what happens? And I'm very forthright because I'm into all kinds of things way outside of the medical community. I just tell them all their options, but I don't want to tell them options that they're never going to be covered for by their own insurance plan, including some plans not covering certain types of disc replacements, which are which are tremendous advancements over, having a fusion or something like that. And so the last thing I want to do is have a 45-minute conversation with somebody about, how great it is that they're a candidate for a total disc replacement. And then they call our office and then they're like, we're really sorry, your insurance company says you can only have a back fusion. And I put everywhere in my note, and the discussion was all about how they're a young patient, we want to continue their mobility and this and that. So it's very, very, it's very frustrating. The other thing that is I see a lot of really people not getting any options outside of what is covered in quote unquote mainstream insurance world. And we have a lot of these lower cost options, or sometimes alternative things. I refer a lot of my patients to naturopaths, believe it or not. When people hear this from a spine surgeon, they're like, oh my God, been spending a lot of times in the Himalayas or something with, some weird group learning. No, it's amazing. And they've done amazing jobs, like looking at microbiomes. And when people have all these conditions that honestly, traditional Western medicine, despite sometimes going to these elite institutions, and you talk about elitism, spending so much money, even if their insurance is covering it, but yet guess what? They still have that diarrhea. They still have this or that. And they come and now people know I'm into all this other. So even when they see me in my spine clinic, they talk to me about everything. And so I try to at least direct them in the right direction if I don't have anything for them. But it's very frustrating because a lot of the things that I bring up in fields that have nothing to do with spine surgery, have you tried this? Have you gone to this type of, they've never even heard of it. Why? Because no one's referring that way, because they know it's not a covered service. So they're like, oh, we're not going to do that, or we're not going to learn about it. Or even worse, doctors, nurse practitioners, nurses, whoever, who feel that if insurance doesn't cover something, it's because there's no evidence to back its use. That's a problem. That's a huge problem. Is back to the CEO of your own health. And I appreciate you bringing that up. So I got that from a good friend of mine, Margaret, who is a massage therapist by trade, but she actually started the Preventive Health Awareness Month in Canada. And actually, it's a real thing. It's a real month. And so she's done amazing things in healthcare. And I heard her say it once, I think it was the first time we were on a podcast together. And I've been using it ever since. And so, now I'm kind of just incorporating it. But interestingly, one of the chapters in my upcoming book is, how to become the CEO of your own healthcare. And you said it right, how we manage. And I want to get this right. It's like we have to think about it, how a CEO manages a company. So, for example, if you're the CEO of Hewlett Packard, you have different divisions. And so patients should think of it different. I'm hiring the dermatologist to be the manager of my skin division. I'm hiring the spine surgeon to be the manager. If for some reason I need spine surgery, I'm hiring the naturopath for whatever, my herbal medicine, whatever it is. But it's all these divisions. But the thing that I want people to understand is you're the boss of that. You don't have to feel like if you're seeing providers that you're not jiving with or you're not getting anywhere with, you can fire them, move on to something, because it's your life, and if you don't feel like it's going down the path you want to go down, or you're on medicines you don't want to be on, or you're having all these interventions and you just don't know, again, that's your manager in that division. You can get another manager, you can get a co-manager, you can get 5 more, whatever you need to do that. So I think it's compartmentalizing that. And I'm excited about that chapter and what people think about it, because it really breaks it down into how to structure this team that you put together, like the dream team or whatever you want to call it. And you want to put together this amazing team to keep this body, because you only have one, intact and doing well, and keeping your family's body intact and doing well. So that's a thing that I can talk about, for a long time. I want to go back to a couple things. I have so many thoughts that you spurred up.
That's a good discussion. Yeah. Appreciate it.
It's interesting. You brought up that book, and it reminds me of a book that I read, the book that you're writing. And it was amazing, because sometimes when you have a little bit of a blank slate, and not that they had a little bit of a less of a blank slate, but it's a book. It's called The Great Influenza. And I don't remember the author. I don't know if you read it. It is one of the best books ever. Yeah. Yes, yeah. I read it during the pandemic. So it's now like 4 years ago. So I can't, because obviously everything was about like germ theory, all that stuff. But it was amazing to see this brilliant group of scientists. They had no idea what was going on. They didn't know if it was they thought it was a bacteria. They had no idea what it was. And like having a blank slate and science coming together, that shows the power of scientific method, scientific theory, the traditional, Western medicine. I mean, it really hit. I mean, it really, it's just amazing. And we're still talking about that, because some of the lessons we learned from that, we tried at least to take some of that into the COVID pandemic, some successfully, some not. But it just reminds me of that, is like when things were more open, there was less influence of big industry at the time. And they just let the doctors kind of figure it out. Eventually, they kind of figured out, yeah, we got to keep people apart, because this is all that stuff. Fascinating book. If anybody, has the opportunity to really go out and read it. So that was just a thought that I had. I wanted to bring up, because we can talk about that, if you have any thoughts on that. But what I wanted to get back to is this patients coming in and seeing you. And the thing, one of the things I've done a post on this, and I think about this really, really deeply. You said it before, we are around brilliant minds. It is so amazing. Like some of my colleagues in endocrinology and liver surgeons and whatever, you name the specialty, they're really brilliant people. I mean, they can tell you inside and out. They know the pathophysiology. They know what's going on. They know the latest treatments. They keep up. They can save lives. But it's interesting when I hear these discussions that these groups have amongst themselves, like you listen to morning rounds, like outside of the ICU or something like that. I just say to myself, yes, for this moment, you're asking all the right questions, right now, because the patient's going to die. If they're in renal failure, we better get them on dialysis, or that's the end of, that's game over. Yeah. But what I don't hear in the doctor's lounge or in these rounds, I don't hear, wow, 80% of the people in my ICU should never be here. They should literally never be here. Most of our ICU should actually be empty, because those chronic disease, what's putting them there? Cardiovascular disease, right? The lung disease, lung illnesses, hemorrhage, strokes, all these things, or metabolic, crazy metabolic stuff that we see. So that question of why is this patient here? What was the last 20 years of this last patient's life? And how does that correlate with why they're here? That's the question that I'm obsessed with now. I
Yeah.
just want to know, like, what is this human being that's in front of me right now? I do it all the time in my thing. I'm like, sometimes I see these patients, they're our age, all right? And you know what I'm talking about. And they look 20 years older. And you're thinking, what in the world happened to this person? It didn't happen yesterday. This is a collection of years. Do you think like that when you see people in the ER? Do you start saying, what was this person like when they were 15 years old? Now they're 45 and they're on more, like, there probably weren't even this many, when you talk about your book, there weren't even that many medicines available for people that this person's on.
Right, right, right.
You know what I mean?
Absolutely.
Like,
Yeah.
how does this happen? Like, with you, do you, like, it's just such a passion of mine.
Yeah. No, I hear you. And I don't think about that all the time, but absolutely I do. Yeah. Interesting and important thought experiment that I do frequently. And for me, it's just doing this thought experiment would result in a health system unmatched in human history and unlike anything we've ever seen. So for me, it's mind-blowing and it's transformational. So here's the thought experience. And you could do it in your own, spine clinic or somebody in a university in the health department or in public health or kind of no matter where you are, you could do this. So the idea is, okay, there's a population of say 1 million people or 3 million or kind of pick a medium-sized city or a big city or something. And then think, okay, our organization, you could even say our business, but our organization, our community, our goal is optimal health and well-being for all at the lowest cost. And we don't get paid. So
Mm-hmm.
I don't get paid as an ER doctor. You don't get paid as a spine surgeon unless you get paid to the extent that that goal is being
Mm-hmm.
realized. So there are metrics around health and well-being, and we have a lot of those DALYs and QALYs and life expectancy. And there are metrics around efficiency. So are we delivering that product? The product is health and well-being of our community. Are we delivering that product at the lowest possible cost? In other words, if a patient comes into my ER over and over and over again with diabetic complications, or they're coming into my ER over and over and over again with mental health episodes, and it would be much more cost effective and humane, frankly, to care for that patient in a preventative, holistic, long-term perspective, then our organization would shift and focus on that because it would be more in line with our incentives, financial and otherwise. And then finally, are we focusing on health and well-being of everyone, not just the most wealthy in our society or the most privileged? So I don't know what that would do for your spine surgery
Doesn't matter. That's not the
group.
goal. That's not the goal.
Right.
The goal is
Right.
to keep people away. I mean, some people need spine surgery, but the truth is, a lot of degenerative diseases in ortho, not just spine, but in ortho, are the result of chronic inflammation.
Yeah.
And so, if we are living in chronic inflammatory states, we're going to have degeneration of our joints. If we're obese, for every pound that we put on, it adds 4 pounds of pressure into our knees. Do you think that you're more likely to need a knee replacement if you're obese and in a chronic inflammatory state, or less likely? It's all, this is my frustration and why I get it's all there. I'm going to talk about the diabetes thing because that one, so the Obesity Code, one of my favorite books. I don't know if you've read it. Jason Funk, brilliant, brilliant guy.
I'm familiar with his work. I haven't read the book though, but yeah, I've
Yeah, the
heard.
Obesity Code is great. You should read that cover to cover. It's great
Yeah.
for us as providers. It's great for patients. I literally sit there with my patients and I make them order it on Amazon while we're sitting there. And they're actually interested. They're like, that's interesting. I'm like, the obese is not a derogatory word. I've learned a lot. I'm not trying to say anything, but please, I'm telling you, this is going to change your life. So it's interesting that if you just look at a condition like diabetes, now we know like there's some genetic factors, but obviously it's lifestyle. So for diabetes, if you go on an intermittent fasting diet, and he talks a lot about this, he's a renal specialist. He's a brilliant guy. He got into a lot of this world about reversing chronic kidney disease. But then he went down this rabbit hole of intermittent fasting, which I'm a big fan of. I'm a big intermittent faster. It's just kind of a lifestyle for me. 80% or so, without quoting exact numbers, because there's other studies other than the stuff that he's quoting. 80%. So 4 out of 5 people can reverse their type 2 diabetes on on an intermittent fasting diet. I also had like a Joel Furman on, the Eat to Live guy. He's a nutritarian guy. He has these amazing clinics that I mean, like these retreats that people go to. He's more of a vegan. He's called the nutritarian diet. Brilliant guy. Same thing on his vegan kind of diet. People can reverse their diabetes. We know all that. So when you tell me about this person that keeps coming back to the emergency room with diabetes, here's the problem. They have providers. We are not doing the things that we need to do. Do you know how many of my patients I asked that are type 2 diabetic, what drastic dietary changes have been proposed? You know, often people say, oh, my doc put me on intermittent fasting. Oh, they went to the strict vegan diet. We did this and that. Oh my God, it's 90% of people. Like, it's the kind of the first time they're, and then then I'm behind because now we're talking diabetes for 30 minutes because I'm upset that they're not taken care of. They're 370 pounds. They're morbidly obese. I mean, at this point, and again, we could have a whole discussion about GLP-1s, but at this point, that's the person that a GLP-1, it's like, what are we going to do at this point? They're like so far down the road. We need to take drastic measures because we don't want them dying of a heart attack in a month either. So, that's where I go, even though I try to stay non-medication with all that stuff. But you're absolutely right. If we had those societies and we poured money into unbrainwashing the public, they are brainwashed by big food. They are brainwashed by big pharma. They are brainwashed by social media. They are brainwashed by consumerism. The American mind, the Western mind is just filled with garbage. And they don't understand how much it's hurting them, but by hurting themselves, they hurt their families. And that collectively hurts all of society. And we can't pay for this stuff. What are we going to do? And here's a spine surgeon getting upset that we can't pay for stuff. And that's why it's funny when you say, well, I don't know what it's going to do for your business. Good. I don't care. I understand. And people are like, well, you've been practicing for a long time. Of course you don't care. No, it's because it's the right thing to do. We have to do the right thing. We have to do the right thing. And I have been I've been pretty excited because even on social, I see a lot of the ortho guys that are doing they're like switching from a lot of joints to regenerative medicine and weight loss programs and all this other stuff. I'm like, wow, people are waking up. And these are the types of societies, because yes, some of that stuff can have some expense up front, but boy, does it save you. I mean, it saves you crazy down the road. I mean, how much would it cost if we reverse somebody's diabetes and they don't end up with a massive heart attack? They don't end up having no mobility. They don't end up in a rehab facility for 6 months. They don't be in an ICU I can go on, and the caregiving and the loss of work and the product, it goes, we are a sick society. Thoughts on what I just said? Like, so many of these people that you are seeing are in the emergency room with constant, repetitive, chronic disease flare-ups because I'm not saying they're not being put on the latest and greatest medications and all the stuff we're good at, right? We're really good at that, but they're not changing their lifestyles. We're not going to the root cause. Like, it is frustrating to me. I'll let you have the floor. Sorry. There's certain things that when I get going, it's like, give that guy some Valium.
I hear your passion.
I need some intranasal Valium, man.
It's important stuff. I mean, it's important stuff on so many different levels. It's important for our nation, for our society. It's important from a bankruptcy perspective. It's important from a well-being perspective. It's important from a burnout perspective, and then of course it's just important from an individual health perspective. Let me just touch on a few topics. You said a lot, but I think we don't have a relentless focus on health and well-being. I mean, that's really what I think it comes down to. And it's not just an individual focus. It's not just a ER group focus. It's a societal focus. Mm-hmm. It's institutions, from licensing requirements to educational requirements to research focus, to policies, I mean, across the board. And we could talk about each one of those in depth, but we're not focused on health and well-being at the lowest possible cost. We're focused on episodes of treatment.
Mm.
And so if let's say if we were focused on health and well-being, then we would also need to an increased focus on trust and scientific literacy. So you touched on that a little bit. We've inherited these ideas that procedures, whether it be laceration repair or chest tube placement in the ER, or whether it be spine surgeries or any number of other procedures, and medications are more valuable than any number of other interventions, from education to some of the less traditional approaches to health and healthcare can carry. So we need to, and COVID has highlighted this. You've mentioned intermittent fasting, and I've heard you talk about the keto diet before. There is a need to evaluate these interventions in a way that is scientific
Yes.
and as objective as possible, and to say, okay, here is the strength and weakness of this study. And that's challenging because there are, I think I heard, it might have been on your podcast, but somebody said every, I don't know, 7 weeks or something. I mean, the amount of scientific knowledge and medical knowledge is increasing exponentially, it seems, and the ability to analyze that data and communicate it in a way that is effective for making decisions is very challenging. So I rely on an imperfect, but I think a valuable resource called UpToDate.
Yes.
I'm sure you're aware of it,
Sure.
but I think we need resources and considering metrics like the number needed to treat. So how effective is an intervention compared to what's the cost and what are alternatives, et cetera. We need to get much better at focusing on interventions that actually lead to health, not interventions that we have inherited from our training, from our societies, et cetera. The final point I would make is that there are many, so I'll just paint a picture. If I'm a single mother living in poverty in the inner city, it's going to be challenging for me to think about what it means to be a CEO of my health. Now, we all have agency and we can all make choices to certain degrees. But some people are born into situations and have different levels of privilege than others. And so as a society, for me, it's helpful to think that, okay, I think it was the county, and I can give a link to this, but the county health rankings evaluated how much of our health status is due to medical care versus social circumstances versus economic circumstances versus behavior, et cetera. Medical care, so the care that I give in the ER and the care that you give in the operating room, only contributes to between 5 and 20% of our health status. So, and yet, like you've pointed out, 95% of our dollars go to that medical care. About 30%, as I recall, is due to individual behaviors.
Yes.
And the book Connected highlights how we're influenced by our friends.
Yes.
We live in this social network where we are as human beings, we're social, and we'd like to think that we can kind of change our behavior all by ourselves. And some of us can because of our disposition or genetics or whatever. But for the most part, we are highly influenced by those around us. And then social and economic factors and the environment we live in play the other percentage of our health status. And so health is a team sport. So if we take your analogy a step further, so we've got our own individual team, but then, if I'm the CEO of the smartphones, I guess, if I'm the CEO of the company that makes the screens, then somebody else is the CEO of the company that makes the whatever, the different components in a smartphone. And we all need to work together to create a product that's health for all of us. So those are a few additional thoughts. I think these are great conversations, but I mean, I think we need to look at social movements and how they've happened. And we just need a critical mass of people that are relentlessly focused on health and well-being, and then focus on leverage points. So are there opportunities for transforming the educational system or for policies, et cetera? Those are some of my responses and thoughts.
I think it's great, and I want to go back to your social experiment, because now kind of in the background I'm just weaving it into things that I've talked about before, and I love that because it's good. You just define a number. You just say, oh, there's a million people, and this is what's expected as far as chronic disease. So we know that our chronic disease numbers are ridiculous. I mean, half of the population is sick, right? Like I forgot the number, but something in the teens has like 5 or more chronic illnesses. And we both see plenty of those because they end up with they have everything, right? It's kind of the repeat customers kind of have everything. So we just say, okay, let this million, what our benchmark is, we don't want them to become, we want to be below this benchmark. And so a lot of people, so what is pharma going to come in and say? Well, you know what? We need better meds. Let's put everybody on let's put it in the drinking water. Let's do this. Interventionalists are going to say, well, the earlier you get this replacement or that replacement, it's better because then, so everybody's got their argument. But I have gone so far down the prevention wellness. Honestly, what if we just what if we just use an AI program and say, hypothetically, here's what it is, here's the general, 2 interventions, just 2 in this society, just 2. One, as part of every, we have a health class as part of, in childhood education. The health class is not really talking about how our lifestyles, then these little kids that are so, we can influence them so much. We really need to focus and have classes that teach them how the interventions, having that Mars bar, that Twix, and then having horrible diets and having the classic American toxic diet, being around toxins, so, filling our brains with the toxins that is, mass media, and we can go on, but having really advanced programs where we teach people, if you do this, you're going to look like this when you're 40. If you do this, you're going to look like this. This is a guy in a wheelchair that is sick, has every disease known to man, has a bag of pills, he's whatever. I think if we do a very intense childhood education program, I mean, one that is main goal is to keep people living healthy lifestyles. Okay. One, the other thing is, we could do a million interventions, but the other thing is you talked about, then you take the bottom half of that 1 million as far as that in the socioeconomic rung, and you make it mandatory, utilizing dollars, either tax dollars or whatever. It's just part of their thing that they're kind of yearly physical. It goes into maybe once a quarter or once, and they have to do it if they want to get like whatever a program. We can figure it out. I'm not a politician, so I'm not going to give you a stack like this for one thought. But in the inner city, what if a part of a wellness visit for them wasn't getting their blood pressure checked or whatever, but it was literally a seminar, educational seminars for these people, really understanding. I've talked about this with some of my guests, how, for example, in the inner city African-American communities, the rates of diabetes, obesity, hypertension, stroke, dementia it's insane. It's literally insane. It's like your entire community is sick. What about an educational program where that mom that's raising 3 kids, is a single mom, is barely able to put food on, really understands lifestyle choices, how we can impact whatever, and then we subsidize those things instead of subsidizing their GLP-1s and focusing on which drug, which pharma company can we enrich by doing all kinds of government subsidies, right? Because now the latest thing is, I heard something I have to tell you, I almost had to pull the car over. I was listening to CNBC this morning. It just happened to be the station that was on. I actually prefer to listen to more like calming music and things like that when I'm driving. But CNBC was on and Jim Cramer was on. He said this exact thing. I almost had to pull. I'm not kidding. I was going to do a post. I was like, he said, listen, you know what? In a perfect world, diet and exercise, and lifestyle, that works, but that obviously it doesn't work. And we failed at that. So now it's time for the GLP-1s. And we just have to be in a world where pretty much everyone's on GLP-1, something to that effect. This is the opposite of what we need to be. It's literally, I wanted to call, I was like, maybe you think Jim Cramer's going to take my call? I don't think so. But what do you think about that? Like really early education, or really going into those populations that don't get, and I clamor. We have a hospital that we cover that's in the middle. It's a level 1 trauma center. And I'm just really clamoring on them to do more education in the community, have more educational events where people are like, because the complaints in those areas, this in an ER, is that the hospital is overwhelmed with people that are uninsured or underinsured. And so I'm thinking to myself, well, why wouldn't you then support and put money into educational programs that keep those people in the surrounding community, not in your hospital, when they don't have potentially insurance, or they're underinsured and you're losing money? Wouldn't that make more sense? So what do you think would happen to that population of 1 million just with education?
Yeah. So regarding that CNBC quote, I mean, that's the logical kind of endpoint of our current system, right? I mean, that's the current. If we continue with the current thinking, then that's the logical endpoint. I think we're both in favor of a more aspirational, a
Yes.
more humane approach.
Yes.
Or I think we need to transform our basic assumptions, and that's what we're talking about. Regarding the 2 interventions that you mentioned, I think they're great ideas on the face. I think the need for education, behavior change is great. I think that in a complex system like health, in some ways, it's much different in a lot of ways, but in some ways, it's helpful to think like an entrepreneur. So in the tech industry, for example, as I understand it, and I used to be a small business owner and worked a little bit in businesses, but the idea behind entrepreneurship, as I understand it, is you try a lot of different things.
Mm-hmm.
So you do a reasonable amount of market research.
Mm-hmm.
And you consider your place in your knowledge and skills, and then you come up with a product or an idea, and then you try it.
Mm-hmm.
And many of your ideas will fail, quote unquote,
Of
fail.
course, of course.
You learn from those. It's an iterative process, and you gain feedback from that experience. You develop relationships with others in the field, and then you try something different. So I would say, with your 2 ideas, you get together with other stakeholders in the community and you say, let's try these things. But the goal is not more educational programs. The goal is not more ER visits. The goal is not more spine surgeries. The goal is optimal health and well-being for all. So you stay just like in the tech industry, the goal is, a phone that we all want to use or something. So you stay relentlessly focused on that, and you're willing to rapidly adapt and pivot to something else, given the situation. So those are my thoughts, but we are set in stone. I mean, I don't know if you're still using fax machines in your office, but that's the example that's always given. But I'll just give a few examples. I mean, I would be in favor of a health professional education and training that's more competency based, as opposed to diploma and licensing based.
Mm-hmm.
So what skills, and this is with physician's assistants and nurse practitioners, this is something that I think is very relevant. I would be in favor of, really, from my perspective, if I start thinking in terms of, okay, a long-term perspective for the health and well-being of our community, that's what's most important. It's not most important to see more patients. It's not most important to meet X or Y licensing requirements. What's most important is the health and well-being of this population at the lowest possible cost. Then it's a vast new world. It is a vast new world. And with the internet and AI, I just listened this morning to your interview with Robert Pearl. The possibilities are limitless. I think the only thing that holds us back are our own inherited assumptions and institutions, as opposed, we can do much better.
No, I love it. And that's what I always say, and I use that. I've done that in a lot of posts and stuff. I was like, we can do better. I love it. That's we can do, a lot better. And going back to the childhood education, because I there's a whole chapter in my book about like just thoughts, and a lot of my book is just kind of my musings on what I've seen, my 20 years experience both as a physician and executive, and now in the wellness thing. But on the childhood education, it's not just, oh, hey, like eat your fruits and vegetable, like that. It's not that for the audience that's listening, is that it's just really connecting the dots between, for example, having the fast food diets that we pour on our kids, that is absolutely the children are preyed on by big industry in this world. It's terrible. Right? We literally, the everything, right? The cereal box is what they look like. Colors, Toucan Sam, you got Tony the Tiger, whatever. It's all to prey on kids. Tony the Tiger is cool, but what's inside the box sucks to have that as a staple of your diet. The amount of sugar in there is like what you should have, in a month. It's horrible. And so I want to connect the dots when the kids are impressionable, because we have to fight back against all these other forces that have them all the time. Ronald McDonald, all these people. Now, the Ronald McDonald, kind of society that helps. That's great. I'm not talking about them. I mean, like the guy that's pushing, the hamburgers and the fries and all that stuff. I'm not saying anything's wrong with it. I've been crucified a couple times when I start posting stuff about fast food. People get upset, including physicians who have said, "Are you saying it's not okay to have a Big Mac?" And that's just one time with this one guy, I said, "Nope, it's not. It's not." I was like, "If you want to get diabetes and die younger, keep at it. It's fine." But I wasn't even trying to say that. It was just because he was so adversarial. I'm like, I'm just going to get, but I'm talking about connecting the dots, because that's where I really see the disconnect. I think that people think that, for example, having a horrendous diet, being exposed to toxins, being exposed to microplastics that are damage our mitochondria and whatever. And I don't want to sound like a goo, because when we start getting preachy, then people kind of tune out. But I want kids to connect the fact that constantly having a fast food diet is why the rates of ADHD are horrible. Constantly doing that is why childhood obesity rates are shocking in our society right now. These kids, they're unwell. They really are not. They're not well, and they are setting themselves up. They are in states of chronic inflammation, and they're 11. They're 11 years old. What does this human being look like at 40? You know what they look like? The guy with the baggie with all the drugs that they're on. And I say, well, what drug? I take the green pill at 11. And I say, well, what do you know what any of those pills are? They don't have a clue. No, because we're going to take care of them. We're going to give them drugs, and then we're going to push them around in their wheelchairs at the fair and all the stuff. I want them to get it early. And I think that childhood education, and there's all these movies, those dystopian movies where they show you the same film over and over again. And then you believe that you grew up on a hill, and grandma, and you used to, take your bike up to grandma. And none of that ever happened, because it's over and over persistent. So if we're going to do that, we have to have an anti-campaign that shows them that if you do this, you're going to be like this. And I think sometimes and I don't think that's it. I don't think, like, I asked, like, my kids, they went to good schools. Nobody ever told them, if you keep eating, like, you're going to get diabetes and lose your leg, when you're older. And I don't want to be shocking. I don't want to make kids cry, but I'm just saying, like, at some point we got to, like, educate these people. Same thing. And in the inner city, it's bad enough that some of the, like, well-to-do people in our society are pretty clueless about their actions and how it turns into their, stroke or heart attack. But again, and you bring it up, and thank you for, you championing social equality, because we have a problem in our society. We have a very sick society in many different ways. That's a whole other, podcast. But again, that group too, having them connect. And I had this Bernard Tony on my show. He was, a PA that was part of the White House, a couple of different administrations. And he was one of my earliest podcasts. And we talked about like in the inner city. And I hear it too. I say to people, you have this, yeah, my doctor says I have the sugar. And I said, well, there's all these interventions, holistic, that we can help. They're like, no, I just take the sugar pill. So I asked him about that. He just laughed. And then he said, well, I do it different. I say, how's your life going to be with no legs? And he said, they're just like, what do you mean? He's like, you're going to have no legs. That's what I mean. because he's from that community. He came from that inner city, and he's like, he's like, honestly, it resonates. They're like, I don't want to have no legs. How am I going to get around with no legs? Who's going to take care of me? So again, that's kind of what I'm getting at with this education. I think it's that connecting the dots, and it's me and my PA. My PA is very much into health and wellness. We talk about this stuff ad nauseum. I'm sure when we're doing cases, we're talking about health and wellness the whole time. And we just say, and we have this saying, and the saying is this: they have no clue. We say this about like our pay, they have no clue. It's like you're telling them like some rocket science thing. It's like, and they don't know, but that's how much this brain has been indoctrinated with this stuff. So that's kind of what I'm getting at with kind of that social experiment within your framework of the island.
Yeah, I love it. Love it. I love your passion. You're almost making a moral argument for the health of our children, and I think it's strong. Things need to change. Regarding education, in my public health training, and this is something I'm not at all an expert on, but there is a distinction, as I understand it, between educating, and I think maybe you and I can relate to this if we think about, okay, we had to memorize the Krebs cycle or something ridiculous like that, So it's one thing to learn something, and then it's another thing to experience information or knowledge in a way that changes our behavior, that changes our vision, changes our and for many that might be because the messenger is a sports figure or a singer or something like that. So the way that information is delivered, or maybe it's from someone that we trust, a family member or something like that. So I love the idea of education. I guess I would shift it to, whatever intervention, as long as it's, that whatever intervention results in the outcome that we're interested in. So I guess that's one comment. I would say that there's two overarching principles or ideas or something that are needed. One is a vision, and that can come through education. It can come through storytelling. It can come through mentorship. It can come through personal experience, but a vision. So the vision, again, I think needs to be health and well-being for all. I think you agree.
Yes, 100%.
It's not exclusively the improvement or advancement in one aspect of science. It's not extreme profits or something. It's health and well-being for all. And then, so regardless of where we are, whether we're university professors or a community advocate or a mother striving, there are ways that we can tell stories, or ways that we can educate to advance that vision. And then the second thing is incentives. So in my ER work, I feel a pressure to do several things. One is give outstanding episodic emergency care. That's what I was trained to do. That's what I educate myself. And I feel very confident and competent in doing that. But that's different than health. But I feel the pressure to do that. I also feel pressure to show up on time, and I feel pressure to see a lot of patients. So we need to shift that so that professionals, and you, I'm sure when you go to do your work, you feel there are certain expectations from your profession and the OR and everything. We need to find ways to shift those incentives so that when I go to work, I feel pressure, I feel an expectation, and everyone that I work with does, to improve the health. And that would just change everything. It would change the way I communicate with primary care physicians. It would change the way that I discuss cases that could have gone better with my colleagues. You mentioned what physicians are talking about in the physician's lounge or whatever. It's rare that we're talking about the health and well-being of our community. So I just think a relentless focus on the vision in every aspect. I mean, regardless of where you are, make that the top discussion point, the top, who are we highlighting in our newsletters? Who are we talking about in our group meetings? Who is getting the financial or other advances? So vision and incentives. I think that's and then that'll translate into policy changes and institutional changes, community changes. Of course, politics is important. Of course, the role of government's important, and there can and should be extensive conversations about that. But I think those discussions come at the expense of our vision and the incentives. Yeah.
Yeah. So I think that, back to your comment about kind of the doctor's lounge. I mean, even beyond that, I've spent a lot of time as a physician executive in boardrooms and things like that. And unfortunately, a lot of the discussion is more around procedures, how the nursing floors are going, how many patients, like length of stay, and how that all ties into CMS, all of these things. But you know what? There's not a lot of discussion of, and believe me, I make it a part of the discussion now, and I know that it makes people zone out because that's not what they do. They're like, we're running a hospital, not your personal well-being clinic here. But it's interesting. We're just not talking about those things. We're talking about we're talking a different language. What is the goal? I love the way you put it. Like, what is the ultimate goal? To have a healthier, happier society, not to episodically treat all these people that are sick. Some sicknesses are unavoidable. You get a car accident. I mean, we can get into car safety. That's a whole other thing, but these things happen. But so much of this is avoidable. That's really what we need to be talking about. And we need to be talking about how do we incorporate, education in patients that are hospitalized. Like when somebody leaves an ICU and eventually goes home, they should be subjected to somebody like literally giving them an educational seminar and why they ended up in that hospital room and how they can stay out of it. Not, here are your scripts. We'll see you later then. We'll see you in 3 weeks when you come back and see Dr. Swanson again. And so anyway, we could go down that, that road. And this has been a great whiteboard session. I think we might have to do it again because this is good. Because when we're both have the same vision, like your vision, like I've had really great guests, but sometimes their vision is, they have a specific diet and that's how they're going to change the world with that or whatever. And it's just different. So we talk about that, or they talk about some energy or another. Our vision is just overall, like, how do we get our society better? How do we get them in this framework? But one of the things I've really enjoyed in talking to you and getting to know you, like live here, is your mindset. I've gotten a lot of stuff out of your mindset, and I think it's amazing. Number one, you absolutely really care about being really good at what you do as an emergency physician. You really care about people, right? Even though we didn't talk about it, that's what you do. You want them to be healthier and happier and maybe not necessarily come and see you. You care about like social justice issues. And again, we're not talking about stuff. If people get into politics and stuff, it's not even a political thing, right? Even if you go, like, if people want to get biblical or whatever, we always want to take care of the least among us. We can't do that in the richest society when people are sick. And I brought up one community. What about the indigenous community? What about the rural communities? Trailer park. Those people are sick. They are my patients. They're sick as all get out. I mean, they're sick. And I mean, you care about all these people. And so you're just very empathetic and you're everything that medicine needs, like to really get, and you want to make these changes. And so I'll leave it at this. One of the things I talk about is physician burnout and stuff. And it's leading to a lot of physicians not even recommending that the younger generation even considers medicine, right? They're just like, you don't want to do this. This sucks. It's a huge problem. I actually talked to Dr. Jonathan Fisher. He's this cardiologist, wrote this book, Just One Heart. We talked about physician burnout's a big thing for him. And we just talked about, and I often ask my guests, like what's the future for these guys? And I think I want to just flip it, or I just want to flip it a little bit. I think for people listening to somebody like you that is in the thing, you're not complaining about what's going on. You're trying to make a change. Yeah. And unfortunately, our profession, because we're burnt out and whatever, you talk about doctor's lounge conversations, a lot of it is disgruntled, deep resentment for even becoming a doctor and everything that I hear it all the time. In fact, that's probably my second book that I'm going to write. Why the baby boomers and the Gen Xers have become so disgruntled with medicine. It's a huge problem. It's a well-known thing. We don't have time to talk about that. But I think that your attitude and your inspiration, I think if young like aspiring med students or people that are in med school or early residents watch you and watch this podcast, they're going to say, that guy really, I want to be like that guy. I just want to help. It's very simple. Do our jobs, but then think about the bigger picture and how we can help, right? Help society. So how have you been able to keep such a positive attitude about? A lot of times I'm very positive. I'm a positive guy, but there are times I'm not positive because I'm just too angry. I'm not angry about myself. I mean, I love my career. I love what I do. And I'm just loving this health and wellness stuff, but I'm angry about some of the stuff that I see. How are you so positive about this? And
Yeah, I mean, no. So I'm a human being just like everybody else. I mean, I get frustrated, I get burnout. I've spent several months kind of burnout with my book. It's challenging. I mean, we're all just human beings. We're on this rock that's spinning around in the universe at whatever speed, and we're trying. We inherited a wonderful, phenomenal system and knowledge base that's also incredibly flawed and incredibly frustrating. So I do the best I can in ways, I guess I try to keep balanced with sleep and exercise and relationships. It's also helpful for me. So I'll just go back kind of the way I started. If you were in the 1880s and you were going to your physician and community colleagues and saying, you know what, there's this new thing called antiseptic surgery, and there's these things called germs. And I've heard about nurses, a new profession that can add to the way that we treat patients. And I might want to specialize in the ear, nose, and throat. You very well might have been laughed at. You might have been dismissed and marginalized. And so we are, I think, in a similar time period where change is hard and it's hard to see the future. They didn't see this day with huge hospitals and advanced surgery. They might have had a glimpse of it, but they likely would have gotten it significantly wrong. And so, but they had a vision. It was a flawed vision, but they had a vision of episodic treatment that we've been very successful with. They had a vision of making a good living, and that's been very successful for many health professionals. And they had a vision of elitism. We can do better.
yes,
We can do better. And so I am motivated and invigorated by their example. And I think every conversation, every discussion, every podcast, every publication, every patient encounter, everything matters. But we need to be relentless about the vision, and we need to change incentives.
that was great. This has been an inspiring conversation for me personally. At some point, I might expand my format and go more like Rogan-esque and just start going. Just say we'll just go 3.5, 4 hours and just let her rip. I'd probably eat a little easier too if we're in studio together, because you just talk and talk. We'll just talk and shoot the breed. But I think this has been great. I think that younger folks should take note. I mean, we have a great system. We are both very grateful to the people that taught us our profession and able to do really amazing things, like things that were never thought that doable, right? The things you save people on. Those people were dead, dead as a doornail if before all these interventions and medications. So again, yes, millions of lives are being saved, but that's not what we're talking about. We're talking about the general health, well-being, not just physical well-being, but also mental well-being of the population. And it is heartbreaking to see where we are as a society with how rich we are as a society. And I know you and myself, and again, whatever, how many of us have family members or whatever that are these people that we're talking about that are so sick. I have a lot of family members that are really bad, and they don't want to listen to me. I'm just, they just like, I'm not going to listen to a lecture from you. And meanwhile, I'm like, you are really sick, and you need help. So I think this has been wonderful. It's been great talking to you, and I'm really amazed by what you do, because I have, there's a lot of ER physicians that are quite, not really happy with where they are in the world. I know a lot of them, and I think when I interview some of them for like later down the road for a book on burnout, I'm going to have to counterbalance them with you. It might go down the road. So again, thank you for being on the program today. Love to have you back on. This has been great. Keep doing what you're doing. Look forward to your book. Where can people find you if they want to interact with you, either on social or if they have some questions for you or anything? Like just give us any information that you want to get out there.
I'm also on YouTube and Twitter, so I try to produce daily videos.
And that's awesome. And also LinkedIn. Let's not forget about LinkedIn,
Yeah,
which
on
is
LinkedIn as well.
where we connected. Everybody has their favorite, platforms where they can get their info out. So yeah, just keep doing what you're doing. It's been a pleasure. And I hope everyone enjoyed this and you've been, watching this until the end. We'll see you on the next episode of Wellness at the Speed of Light. Thanks, Dr. Swanson, for being on the program today. I'm your host, Dr. Stefano Sinicropi, and we will see you next time.